Hello, everyone. Guess what? We're finally going to get to this topic of contraception, or what someone would know as family planning. Why are we going to discuss this? Well, it's believed that this is one of the best ways to be able to help reduce maternal death. Why is that? Well, if you're sexually active and you are using a contraceptive method, then it will reduce your chances of becoming pregnant. Once you become pregnant, you are then exposed to the health risks that are associated with pregnancy. And what are those health risks? Well, those are the risks that are underlying the causes for why women are dying. Mental health, which can be exacerbated with pregnancy. We are also talking about hemorrhage that can occur during pregnancy or after you've had your baby. We're talking about gestational diabetes, which can occur during pregnancy. And once you have gestational diabetes, you are at a greater risk for having diabetes later in life. The other is cardiovascular disease, which includes high blood pressure. It would also include preeclampsia or eclampsia. Those terms are known as toxemia if you talk to your grandmothers or aunties. And also cardiac disease, where there is actual heart problems. So, if you are using a contraceptive method, it will help to decrease your exposure to this due to your decreased probability of becoming pregnant. The other thing to know is that when we talk about family planning contraceptive methods, there are many classifications. We have the methods that are non hormonal methods, meaning that no hormones are used for these methods to be able to work. Those methods would include things such as the diaphragm, the condom, fertility awareness methods. Those would include standard days method and also the lactation amenorrhea method. There are also hormonal methods, and there is a big selection of hormonal methods. We're all very familiar with the pill, which is contraception using hormones. We're familiar with the injectable Depo-Provera. We're also familiar with the IUD. Some IUDs have hormones and some IUDs do not. The other is the vaginal ring, vaginal patch. I'm sorry, not the vaginal patch, the patch that you would wear on your skin. I'm thinking about the vaginal film, which would be a non-hormonal method. Contraception is also divided into classifications of short-acting methods and long-acting methods and permanent methods. Guess which ones are the permanent methods? Yes. Vasectomy or male sterilization, tubal ligation, getting your tubes tied, that's considered a permanent method. I want to say with the permanent methods that there is still a small risk of you getting pregnant, even after you've had your tubes tied and even after you've had a vasectomy. That risk is very small, like 1 to 2%, but that risk still is there. Short-acting methods are your contraceptive pills, the vaginal ring, the patch that you would wear on your skin. Long-acting methods would be considered the IUD. So these are methods that we will have further conversation about in the future. So I hope that this is something for you to begin thinking about and to begin looking at. So if you have liked my information, I'm going to ask you to please like and subscribe. I need that. I have close to 10,000 viewers, and most people who are looking at my information are not subscribing. I need you to subscribe for me. Let that be your Christmas gift to me. Okay? Would you also share this channel with your colleagues, with your girlfriends, boyfriends, your sisters, brothers, aunts, uncles, aunties as well? So thank you again for your time. And the next time that we come together, we're going to talk more, delve more into one of these classifications of contraception. Have a great night. I look forward to talking with you again. Bye bye.